Can you give any insight on sweeteners and the relationship with good and bad bacteria, especially sucralose? Thank you.
Well, I don't know if I can comment specifically on sucralose, but we do know that any sort of refined sugar, excess sugar, that does pose an increased risk for developing worse bacteria. There are studies that show that any artificial sweeteners, anything in, for example, Diet Coke, Diet Pepsi, all of those artificial sweeteners do negatively affect the gut microbiome. So as much as possible, I do recommend just avoiding as much processed sugar as possible. I don't know if you have anything more to add on that, Dr. Laster.
I would echo the same thing. I talk about there's studies that show sort of the changes in microbiome from sweeteners in general, and also the symptoms that patients get caused as well, like bloating and that sort of thing. So I just try to get people to avoid sort of artificial sweeteners in general.
There was an article presented this week on sucralose and aspartame inhibiting liver detoxification pathways. It was actually presented at a GI meeting. So just one more nail in the coffin of yellow and pink packets, blue packets.
Raymond, would you like to ask a question, and where are you from? Raymond, would you like to ask a question?
And so if you could just do me a favor.
Raymond, would you like to ask a question?
Yes, can you hear me?
Yes.
Yes, I've heard the doctors talk much about the gut microbiome. Can you be a little more specific in talking about how important that is? Because I've heard, even just now, you just mentioned that. So two of you did. So can you talk a little more about that?
Sure. So, as new research is coming out, the gut microbiome is, a really hot topic. I would feel like every day there's new research articles coming out about how the gut microbiome is affecting not just GI illnesses, but I feel like it's basically been linked to any chronic medical condition. The gut microbiome has been linked to cancers, lung disease, atherosclerosis, arthritis. So, I feel like, this might be my bias, but as a gastroenterologist, I really believe that the gut microbiome is the biggest proponent in developing chronic medical issues. And if we can take good care of our gut microbiome, then we are putting ourselves at best chance for staying healthy and having less risk for inflammatory conditions down the line. We've talked a lot about how diet affects the gut microbiome, that we know processed foods, animal products, sugars negatively affect the gut microbiome. One thing we've not talked about is that the gut microbiome can really rapidly change. So this is not a quick change or fad diet. This needs to be consistent lifestyle change. Research has shown that if you change your diet and you transition toward a plant-based diet, we can see effects in the gut microbiome within just one day. And we've also seen, conversely, that in research trials where people go back to their normal routine diets afterwards, that within just a day or two, their gut microbiome reverts back to the way it was before. So we do know that diet makes a huge difference in the gut microbiome. Consistent, healthy eating, plant-based, diversity of foods will improve your gut microbiome. And I really feel like the research is, every day there's like dozens of articles coming out just supporting the fact that the gut microbiome is linked to every chronic inflammatory condition that I can see. So if anybody knows of a condition where the gut microbiome is not impacted, I would love to know that. So.
Tracy, would you like to ask a question, and where are you from?
Yes, I would like to ask a question. I'm from Florida. And I wanted to know, I'm a plant-based healthy eater. I don't eat any animal products with the exception of sometimes sardines or eggs. And that's like maybe twice a week. And I was wondering, my cholesterol has been historically high in that my LDL has been high, my total cholesterol, and yet my ratios, and this is a question I have, am I looking at these total numbers or are ratios, how does the panel feel about ratios like triglycerides to HDL or total cholesterol to HDL, those ratios? And then one last thing is my fibrinogen has been over 300. And where does that play a role in atherosclerosis, perhaps?
I'll volley in as Dr. Kahn. The problem with the ratios that involve HDL, and clearly a higher HDL creates a lower ratio, which is healthy, and a low HDL creates a higher ratio, which is unhealthy, is generally the cardiology community has put a hold on using HDL as a predictive biomarker. It used to be simple from the Framingham study. Low HDL risky, high HDL protective, but there's total confusion in the literature. There's many case series of people with high HDL and premature hardening of the arteries. So if you rely on the ratios, you're buying into old science, and the current guidelines don't emphasize anything about HDL measurement, HDL treatment. It's good to exercise. Maybe have a glass of red wine 1 or 2 times a week if you like or not. That may raise your HDL, but there's really no emphasis on it. So I think it's obsolete right now that we get better tests. I think your total cholesterol and your LDL cholesterol are where you ought to emphasize, and talk to your doctor if you've never had a coronary calcium CT scan. If your score is 0, you don't need aggressive therapy. If your score is 389, you need to find a lipid expert, cholesterol expert, preventive expert, Dr. Montgomery expert, and figure out a natural or a dietary or a pharmaceutical way to change your numbers.
Yeah, and I'll add to that. I agree with the issue of ratios, but I'll also add, whenever your numbers are not optimal, even on the healthy diet, you just need to, just like we'll increase the dose of a medication, you need to increase the dose of your diet. So I would say the total elimination of all animal products, including eggs or sardines or whatever animal products someone's eating. And if that doesn't work, I would go to a raw diet with time-restricted eating. So, it's sometimes people come in with say, I'm eating the best diet, and you're right, you're eating, a good diet, but maybe you just need to tweak it a little bit. And sometimes you make very small changes, you can get very big results in your overall biochemistry. So I would start there typically with my patients in making those extra dietary changes to be more precise. And we do food dietary histories and the like.
Brenda, would you like to ask a question, and where are you from?
Thank you. I'm in Washington, D.C. And there were a couple quick questions just as a reminder. What was the name of the cardio examination that was like under $100 that the cardiologist recommended? Just maybe the name of that exam. That's not my question, but just trying to remember the name of that exam.
Yeah, probably the most frequent abbreviation is CACS, coronary artery calcium scan, or coronary artery calcium score. You can do it either way.
Thank you. And I just wanted to find out from each panelist if there was one change. I know people mentioned the raw food diet or mentioned fiber, et cetera, but in your particular area of expertise, if there was one thing someone wanted to do this week to get to a healthier gut health or better heart health, what would be your recommendation based on what you've seen is helpful in general for most people?
I could start from a GI perspective for as far as the most common symptoms we see being sort of bloating, abdominal discomfort, constipation, and in my practice, obesity. And I would say that one huge thing for me is getting patients to drink water. If I can get patients to sleep and to drink water and sort of to remove sugary beverages and sodas, that way, if I could only choose one thing, that's usually where I start. I get people to drink water.
I'll jump in. I would put them on, if they're to do one thing, sort of a collective thing would be to go on a raw plant-based diet with time-restricted eating. We do that first and foremost with patients. I agree with the water component because water is probably the most important nutrient. If someone's consuming all their plants raw, if you're eating cucumbers and lettuce, carrots, etc., those plant foods in their natural states are like 80–90% water. So you're eating a lot of your water in addition to the water you drink. And so 90% of your consumption is going to be water with the micronutrients, phytonutrients, fiber, and things that goes with those raw plant foods. But I would do that with time-restricted eating because that increases your fasting window. So we do like eating from say 10 to 5 or 11 to 4, 11 to 5 is your feeding window of raw plant foods, and the rest of the time water while you're awake and sleep while you're asleep.
Sarina, you want to jump in?
Sure. I mean, it's so tough to just say one thing because really it's minimizing and eliminating the processed foods and animal products. And instead of, you know, eating those things, substitute it with fruits, vegetables, and whole grains. It's really kind of a switch. When you take something out, you need to put something in because, you know, the goal is not for you to be hungry and starving. So minimizing the processed foods and animal products. If there was, like, if I had to just give one food item to eliminate, I would say for me and my patient population, dairy causes the most issues. Dairy causes a lot of inflammation, bloating, gas. A lot of patients have lactose intolerance. So if it was one swap that you're looking for that's super, I think, easy is eliminate dairy and swap it with a plant-based milk and cheese. But you're asking a tough question. You know, it's not easy to answer.
And Joel Kahn, I was going to bring up dairy, so thank you, Sarina, because there is an easy substitute. And so my answer would be stop eating processed meat, which the World Health Organization says causes colorectal cancer. The Gates Foundation says is the #1 food that predicts shortened lifespan, and it is tightly linked to cardiovascular disease, congestive heart failure. But then you got to come up with a substitute, and I don't want people eating, you know, plant-based sausages long term. It's an acceptable short-term switch if they're not very sick. So stop eating bacon, start eating a salad. It's not exactly an equivalent switch though.
Gregory, would you like to ask a question, and where are you from?
Yes, I would. Can you hear me?
Yes.
Yes, I'm Gregory Jones from Plainfield, Illinois. And I've noticed certain foods over the years give me joint pain and mucus and cause me to have a runny nose. So I assume I have a food sensitivity. I want to know if that assumption is correct. And if so, also I've heard of the term leaky gut. So I'm wondering if that also means I have leaky gut. And if so, how do you test for leaky gut? How do you get tested for that?
Okay, so I can talk about, so leaky gut is kind of what people in the lay public talk about, but we don't really use the words leaky gut in our GI literature. People who get leaky gut usually have abnormal gut bacteria and gut bacterial dysbiosis. When you get abnormal gut bacteria, the layer of cells that is there to protect you from your gut into your blood, the gut-blood barrier, that becomes weakened. And that's something called gut permeability. That's what we kind of say for leaky gut. Basically, the bottom line is if you think you have leaky gut, it's probably that you have unhealthy gut microbiome. And the best way to fix that is to change your diet and lifestyle. That's kind of like a short answer for that. And then food sensitivities, you know, we are seeing a lot more patients come in with food sensitivities. I think I like that you say food sensitivities. Some people mischaracterize it and they think they're allergic to foods. An allergic response is very different than a sensitivity, just in the immune system and the way that allergies are immune mediated, IgE mediated. So food sensitivities means you don't tolerate it well. But what I like to, talk to my patients about is that it might not be that you are sensitive to that specific food. It might be that your gut microbiome is altered, it's not working properly. So right now you can't tolerate that specific food. It doesn't mean that you can't tolerate that food in the future. If you can work on your gut microbiome and make positive changes, many of those patients that I see that have a food sensitivity and can't eat certain foods, they're eventually able to eat those foods without any problems at all. Just remember, your gut is a muscle. It needs to be used. It needs to be trained properly. And for most people, we've been training it wrong for many years, even decades, by eating the wrong food, not getting enough sleep, not exercising enough, consuming too much alcohol. We're training it in a wrong way, and now we have to retrain it. And it's not always easy. Just trying to get your gut microbiome healthy, making a switch to a plant-based diet, that alone can cause some bloating and gas. That should not deter you. That is part of the process of when you switch and transition to a high fiber diet, there can be some uncomfortableness and discomfort, but keep persevering and keep trying to do what you can to improve your gut microbiome, because many food sensitivities will go away if you have healthy gut microbes.
Great. If each of you would make a closing 30-second statement to wrap up any final thoughts, and also let us know what's the best way to get in touch with you. Also, for all of our listeners, if you go to our website and you click on the bio of any of these speakers, it'll take you to the website and what they are mentioning now. But if you could just tell us the best way to get in touch with you, your books, your website, and if you offer Zoom appointments, if each of you could just take 30 seconds to give a closing statement and tell us how to stay in touch with you.
Sure. Joel Kahn, I'd say the most powerful tool for prevention and healing is to master lifestyle medicine, focusing on nutrition, and do it early in life as possible. I can be found on my website, drjoelkahn.com, drjoelkahn.com. I'm licensed in most states in the United States, and I do telehealth, but I have an active live office. Just fly to Detroit. It's wonderful.
Thank you.
Janese Laster, I would say for my closing remarks, let's see. Whatever symptoms you're having, whether it be GI symptoms, whether you think it's something embarrassing, if it's stool related, if it's excess weight, difficulty with weight loss, talk to your physicians about it. Let's just get it out. You can talk to us about anything, and let's find you a solution. And I can be found, I'm in Washington, D.C. I do see telehealth patients in the states where I'm licensed, about not as many as Dr. Kahn, but maybe about 8. And you can find me on, or you can come to DC. It's fun here. And find me online at guttheoryhealth.com.
Thank you.
This is Sarina Pasricha. Thank you for having me on. If I can just kind of leave one thing, it's just remember that your gut, those gut instincts that you have, those feelings are real. What's going on in your GI tract is going to affect your mood, how you feel, the energy level you have, and vice versa. The stress, the anxiety that you're feeling, or the happiness and joyfulness that you're feeling will in turn affect your GI tract. They are linked. Don't ignore those. And just remember that the key piece to all of that is your gut microbiome and the invisible bacteria. You can find me on my website, www.docsarina.com, Doc Sarina. And I'm on Instagram and Facebook at Doc Sarina, DOCSARINA. Sign up for my newsletter to be coming soon. And I only see patients in person, so you'd have to come to Delaware, but I'm happy to see you. So thank you.
Thank you.
Baxter Montgomery, and my final comments are simply, optimize your life, and optimize your life. You need to optimize your health. To optimize your health, you need to optimize your lifestyle. That's going to start with your nutrition, proper sleep, exercise, healthy relationships, and the like. Be mindful of your vices and go toward those vices and attack them first and foremost. I can be reached online at montgomeryheart.com. That's montgomeryheart.com. You go to our website, and there are a lot of programs and things. We see patients here in Houston. The Texas Medical Board allows us to see patients nationally if you've made an initial office visit here in Houston. And we have patients across the country who see us through remote. We have a digital health clinic. We also have online wellness programs. And if you go to montgomeryheart.com/journey, you can learn about our online health programs, our healthy lifestyle series coaching program, and our community that we have that help people come together and optimize their life.